Over the weekend, the U.S. hit a grim milestone. The U.S. COVID-19 death count topped 500,000. That's roughly the population of Atlanta, Georgia in its entirety. Those are mothers, fathers, sons, daughters, friends, and colleagues that won't be at Thanksgiving this year. It's the birthday party with an empty chair, and it's the night out with friends that's just one or two short. But with vaccine distribution well underway, there is a clear light at the end of the tunnel. But the question is, when exactly will we get there? When will our lives and our economy return back to normal? Or at least embrace whatever our new normal will be? Bruce Lee of the CUNY School of Public Health may have some answers to those very questions. Dr. Bruce Lee, he is a professor of health policy and management at the CUNY Graduate School of Public Health. He's joining us now. Dr. Lee, thanks so much.
Thanks for having me.
Governor Andrew Cuomo opened up indoor dining in New York City on February 12th. There was a lot of backlash from public health officials saying things like the death rate hasn't, or the daily case count, the death rate hasn't gone down enough to really warrant that. We're about a week or two out from that. What does it look like, and do you think that was an appropriate move?
Yeah, so the challenge right now is we can't really use the death rate or hospitalization rate as a measure of like what's happening right now with the virus, because there's a 2 to 4 week delay at least. Because if you think about it, people get infected with the virus, and it takes about 5 to 6 days on average for people to then start developing symptoms. And then if you develop symptoms and get hospitalized, that might be after a week or so. And if you don't survive, that actually might be an additional week or so, et cetera. So what we're seeing right now in terms of the hospitalization rate and in terms of the death rate is based on the infections that actually started or occurred several weeks ago. The reason why there was concern about doing things such as reopening indoor dining is we're in the midst of the worst part of the pandemic to date. That's January and February, December, January, and February, basically when the lower humidity and lower temperatures probably increase the transmission of the virus. So what we really want to do is get through this period of time, get to March at least, when the weather starts changing and perhaps transmission starts dropping. This is really the danger zone right now. That's why the concern among public health experts and officials was, can we just hold off before we make any changes until we get to a situation where the weather is actually starting to move in our favor?
Does that have anything to do with the new variants that are out there?
Well, that's the other concern, that we have new variants that are spreading, and these variants are potentially 50 to 70% more transmissible than the circulating strains, the predominantly circulating strains for the past year. So these variants can be more contagious and spread faster. So what we want to do is we want to make sure that things don't get out of hand during this month because the variants are spreading as well.
The vaccine rollout is well underway in New York City. They opened it up to the immunocompromised. We're moving forward in a lot of ways. There is guidance that people should still, even though they've gotten the vaccine, wear masks and social distance. Why is that?
Yeah, so there's several reasons. So one is the vaccines are not 100% effective. No vaccine, nothing really is 100% effective. So even if it were 90% effective, there's still a chance that if you've got the vaccine, that the vaccine will not work 100% against the virus. The second issue is we don't know how well the virus actually prevents you from getting infected with the virus and then spreading the virus. If you look at the clinical trial data, the 90% effectiveness numbers are how effective is the vaccine in preventing COVID-19, moderate to severe COVID-19 with symptoms. So there's still the possibility that you even if you're vaccinated, you potentially may acquire the virus and carry it more silently and spread it to others.
Dr. Bruce Lee, thanks so much for joining us.
All right, thank you, Andy.
And that's your Business Brief for today. I'm Andy Hirschfeld in New York.